The Affordable Health Care Act, currently the law of the land in the United States, is one of the more controversial pieces of legislature to be passed in recent times. Opposition for the law has been strong. The government even shut down for a few days over the disagreements. What is the big deal? What does the Affordable Health Care Act do? And how can so many people be opposed to affordable health care? Well, people are not opposed to affordable health care. Most people would be happy to get good care at lower rates. Let's look at some of the problems the Affordable Care Act is designed to remedy. First of all, the ACA aims to increase coverage. 32 million Americans who would not have been covered by health insurance either now have coverage or will get coverage starting in 2014. This includes youth who may be added to their parents' plans, patients with pre-existing conditions, and those who simply cannot afford health insurance. Secondly, the ACA has the potential to reduce healthcare costs. Since preventative care will be more widely practiced, ailments will be caught earlier and will be less costly to remedy. Thirdly, the ACA implements a new set of taxes that has the ability to reduce a national budget deficit by $143 billion by the year 2019. Americans who earn more than $200,000 a year will pay higher taxes to help cover the cost of the currently uninsured, and Americans who choose not to purchase health insurance and who make too much to qualify for Medicaid will also be taxed, starting at $100 per person per year in 2014 and rising to $700 a person a year in 2016. Already, it sounds like the Affordable Care Act only makes care affordable to a certain percentage of the population, and the rest have to pay more to compensate. Let's look at some of the negatives to the Act and figure out why the law has met such opposition. The majority of fundraising for the Act comes from a few major tax increases. The first is a 40% tax on all family health insurance plans valued above $27,500. Many families that make far less than $250,000 a year have high-end health plans and will be subject to this tax when it goes into effect in 2018, breaking President Obama's pledge not to tax these families. The second is an increase on the hospital insurance portion of the payroll tax. There is a long-standing tradition that the payroll tax should be used exclusively to fund Social Security and Medicare. The increased hospital insurance rate not only breaks this principle, but also, and for the first time, will fund a new, separate entitlement. With this precedent broken, future Congresses will be tempted to use payroll tax increases to pay for other new programs that the tax was never intended to fund. There is speculation that the Act may cause unforeseen problems in the healthcare supply industry. A new study by the National Monitor predicts that the implementation of the ACA, coupled with the nation's aging population, could lead to a shortage of 52,000 primary care physicians by the year 2025. This could leave millions of Americans without access to health care. Pharmaceutical companies will pay an extra $84.8 billion in fees over the next 10 years to pay for closing the donut hole in Medicare. This could raise drug costs if they pass these fees on to consumers. Employers also have a new mandate to provide health insurance for their employees. Employers with more than 50 employees that do not offer coverage will pay a fine of $2,000 per employee, excluding the first 30, or $3,000 per employee receiving the premium tax subsidy. I could continue on about tax increases, but it is clear that the American people will bear the burden of funding the affordability of the new program. Without a doubt, the Affordable Care Act will raise the cost of health care across the board. It is also poised to affect the market for entry-level job seekers. The employer mandates penalty specifically raises the cost of hiring lower-skill workers, because the penalty is a higher proportion of their compensation than for high-skill workers. Industries that have traditionally offered the greatest opportunities to entry-level workers, leisure and hospitality and restaurants, will be particularly hard hit by the new law. Furthermore, the American people do not support the Act. Support has been on the rise recently, but studies such as one taken by the Kaiser Family Foundation show that people are not really sure how the new law will affect them. The law was never sent to ballot, and the representatives who fought it were defeated, so a relatively small group of people were able to push it through. I do not have a problem with affordable health care. I don't even have a problem with public health care, but I don't trust our government to do it. I can't trust the government with much. Any government program I have come in contact with in my short life has been a wreck. Our elected officials seem out of touch. Our nation's in a pitiful amount of debt, and now I am forced to trust the same government to distribute our money efficiently so that we can enjoy better health care. To me, this is the biggest problem. If the government and its officials kept their promises, if those in power could be trusted to do what is right, then the story would look different. I am all for affordable health care, but let's make it affordable the right way. True affordability does not include government funding and control. It includes making care and medicine inherently less expensive, for instance, by educating the citizenry on basic healthcare principles or developing better techniques for drug and medicine manufacture and use. It seems the government should be able to advise or aid the private sector without absorbing parts of it or passing laws on what must happen. Anyway, there are some pros and cons on the Patient Protection and Affordable Care Act and its implementation. Thank you.